My name is Renaat Coopman. I'm currently a craniomaxillofacial surgeon. I work at the Ghent University Hospital. I've been there now for 6 years, and I'm a great enthusiast about 3D planning, 3D printing, and virtual surgical planning. Myself, I'm really involved in preoperative planning. We do our segmentations ourselves, all of our residents and the surgeons. We make our own cutting guides. We're now fully dedicated of building our own in-house point-of-care 3D print lab. We currently use the software of Materialise. We use the Mimics software, the Enlight software, and also the 3D software. We like it because it's an open platform. It is intuitive, it's open. We can freestyle with other softwares in order to get the perfect planning for our patients with as much as perfect outcome as we can get. The reason why we like to use Mimics Enlight CMF is we were dedicated users of the ProPlan CMF. We chose for ProPlan from the beginning because it was an open software package, and it covered the entire load of the CMF pathology. Meaning we could do hard cases of congenital surgery, but we could also do the oncologic reconstruction, and we could do the orthognathic planning and also the reconstruction there. So it was a logical step if you saw ProPlan to go to Enlight. Enlight is very well thought through. It has also an intuitive workflow. The first case I ever planned with Enlight was by maxillary osteotomy. That was the case that really triggered me from this is really the software I like to use. The case that really remembered or stayed with me with the Mimics Enlight was a reconstruction case of an oncological resection that we had to do. And then my dear colleague Matthias Ureel, he started to play with other software types. And that's why I really like the software of Materialise. It's not closed. They like to include other software and they allow innovation. And that case made it possible that we could do the jaw in a day procedure in a really good, precise way by using different kinds of software. We use dental software in order to make the dental implantation. We then made the cutting guide using the dental software. And then you could use the STL import of Mimics and Enlight, and then you could mix, match, align, and then you get sort of advanced cutting guide with all in. And that was a real case that really stayed with me for 2 reasons. Because that was the case we got 0.6 millimeters of precision. That means we're actually on the slice thickness of the CT. You cannot really do much better than that. And I still remember the patient because he was a young person, 27 years old, amyloblastoma of the left lower jaw. He was eating sandwiches after 2 days. So that really made, and it only happens if you're allowed to be innovative and you have an open software platform. I think that's the biggest advantage that the software of Materialise allows. And yeah, that was a case that really stayed with me. To use Enlight to plan trauma cases, I think it's one of the first softwares which is capable of doing it in an organized way. Planning fractures, puzzling the bone pieces together, always oblige you to think. That's why I like the preoperative planning, because you have a certain plan in your mind. So the moment you go to surgery, you have already something, a workflow or steps that you need to follow. So that is a very good handful tool. I also talked about it with the colleagues, with the design team. I think in the near future, all the off-the-shelf osteosynthesis plates and screws, they will be sterile, pre-packed. And then I think it will be a very handful tool, I think, at least to plan which type of plates you will need to have, so you don't open the wrong plates or the wrong screws. because yeah, every plate you will open in the sterile package will have to be charged to the patient. So I think that there will be some sort of change there in the near future, that it will be more and more useful in the regular clinical work and daily basis. Special trauma cases in-house gives you the advantage of time, because complex trauma cases, they come and then you have to act. I think also with the orthopedic boards, we have to sit together to make this more dedicated use. But outsourcing, for my personal belief, is cutting guides, anatomical models. That's something you should produce in-house because it's quick, easy accessible, and especially in the trauma cases, especially you could have it the next day in your surgery. If you talk about implants, titanium prints, PEEK implants, those are things that can be planned. And I think those are the things you have to outsource. But in trauma cases, sometimes, especially in multifractural cases, for example, a few weeks ago, together with the orthopedic surgeons, a young girl, 14 years old, blind corner accident. She got under a truck. It was a very horrible accident. But then if you see the pelvis and the thing, then you need to have a centralized 3D print lab at least to have some sort of reference anatomy close by, and that's where that puzzling with the orthokinetic case will come in handy. So you have a plan and you look how to puzzle it together virtually, but automatically you make a plan in your head, step, a workflow that is always useful in surgery. Yeah. It's a software that is actually community-based. You can give valuable input. The development team will listen to you if it's a valuable input. It's an open software that is also very good advantage and easy to use. So for me, it has all the advantages and not much disadvantages. And what I consider as a disadvantage, you can talk with the engineers and they're trying to solve it in the next versions. So I'm a big fan. To keep it community-based, that's the most important thing. I told also with a few colleagues of you, you see, I come here already a few years now. I think even as a resident I was here. You see people who are coming, you see people who are going. But the community is there, and even in the sessions, everything is peer-reviewed. And then even now we had discussion on what should be the future of Enlight, where should we talk about, or what's the path we should follow. And then you see everybody's on the same line, but everybody has nice input. Oh, no, I didn't thought about that. Oh, that's a good idea. No, we should do that first and that second. And that's why community-based and the 3D printing community here and the yearly meetings, in my opinion, really valuable. Also as a strategy on the long term, that everything is peer-reviewed and you're following step by step the right path of between what you can offer and what is actually the clinical necessity. And some expert-based other platforms are more closed and more rigid. They're good, they have a very fixed workflow, but if you have to freestyle in these special cases, especially in a university hospital, then you get blocked or you have to go to another pathway, and that's where you lose a little bit of your creativity and your innovation of yourself, and you're once again dependent on somebody else. And my opinion, I like it more the way it is like now with you guys. Okay.